Hello and welcome back. Today is all about before you've been diagnosed with diabetes. So today we're actually going to be talking about who's more likely to get it and who are the high risk group of people and what can you do basically to prevent it on diabetes. So when we talk about risk factors, first and foremost, just because we are Indians, we're Southeast Asians, we're at already a higher risk compared to Caucasians to develop diabetes. So everything I talk about henceforth is going to be in relation to us being Southeast Asians, and the numbers and figures and risk groups for Caucasians are slightly different when it comes to diabetes. When we talk about age, in Southeast Asians, it's actually considered anything above 25 years is considered as a high-risk group of diabetes, simply because we tend to get it earlier and at an earlier age. The other most important risk factor is going to be a family or genetic background. So if you have somebody, let's say your parents or a sibling who has diabetes, or even someone in your first relatives or second relatives who have diabetes, you're going to be at a higher risk of developing diabetes, at least type 2. So the next is going to be certain diseases that kind of predispose you to developing diabetes. Number one would be PCOD in females, so polycystic ovarian disease. It could be GDM as well, a gestational diabetes mellitus. So you had sugar just at the time of pregnancy and it ended. That's a very significant indicator that you may develop it in the future as a permanent state. The third would be any cardiac diseases, including hypertension, that could lead to later on into diabetes as well. The other one is kind of a disease and a lifestyle choice as well. So it comes down to obesity or being overweight. And in Caucasians, it's a little bit different, like I said, but in Southeast Asians, it is considered at any waist circumference above 80 centimeters in female, and any waist circumference above 89 centimeters in males is considered as a high-risk group for diabetes mellitus. Lastly, there's a small group of people who may be at high risk simply because they're taking medications for certain diseases like schizophrenia or bipolar disorders. And if you are on certain medications regarding these diseases, your doctor should be prescribing you tests in a periodic manner to assess your diabetes status. So those were the high-risk group of people for diabetes. Now you may be thinking you are in one of them. So what can you do to prevent it? Diet becomes key here, of course. Simply put, you have to reduce the amount of carbohydrates. Do not avoid them, because glucose is still going to be your main source of energy. You just need to reduce them, and in place put proteins, which will help your body and your insulin work better. Try to stick with a lot of green leafy vegetables, a lot of fresh fruits, because you want to give your body a lot more fiber to work with as opposed to carbohydrate. Opt for protein-rich options, and try to take your meals which are not in large quantities at one point of time, because you don't want to shock your system with an excess of glucose. Secondly, very important, exercise. Exercise is mandatory. You should try to aim at about 30 minutes per day for at least 5 days or 6 days a week. Recent research has shown that weight loss is actually one of the biggest key in causing a remission state of diabetes. Remission just means that you haven't had to be taking medication for diabetes for a certain period of time, and you can reach this state especially if you are suffering from diabetes because you are overweight. So loss of weight significantly helps and reduces the chances of diabetes. If you have any other diseases, if you have hypertension or PCOD, make sure that those are well managed and that you are periodically getting yourself tested for diabetes, or if you are in a pre-diabetes state. So that's it from me, you guys. I hope you guys have figured out if you are in a risk group and what you're going to do to avoid it as much as possible. As usual, if you have any questions, any comments, please put them down below. I do try to reach them and respond to them as early as possible. If you have any other topics you'd like us to discuss, do put them down as well, and we will take the ones that are most popular and make it into a video. Lastly, like and subscribe, and do share with your friends and family if you think this is some kind of knowledge that everybody needs to get. If you have family members who are diabetic, it would really help them out. So I hope you guys are all staying safe and healthy. Take care, guys. Thank you.